And then I'm going to make Shannon the host. All right, there you go. Shannon, you are good to go.
Hi, I hope everyone can hear me. Natalie, are you able to hear me?
Yep, I can.
Okay, awesome. Okay, I just wanted to make sure. I'm going to go ahead and share my screen so everyone can see the PowerPoint that I have up here. Give me just 1 second. Perfect. And Natalie, can you just confirm that you could see my screen and everything?
Yes,
That way I know everyone else can.
yep, you're
Okay,
good to go.
awesome. Okay, cool. Okay, so let's get started. Okay, so a little bit about me, just for anyone who's curious. I've been a feeding therapist since 2018. I currently lead the occupational therapy groups over at the academy. So if your child is enrolled there, then they probably know me from groups. And I have lots of different training. I have training in oral motor skills, sensory processing, and more. So I've gotten a lot of good experience in the feeding world, and I love it. All right, so let's just start off by going words, and I did it last week. Some of this could be repetitive, but I tried to make it a little bit different so that we could focus on more of the sensory piece. But so sensory processing difficulties, this is one that we're going to be talking about today. That's definitely a feeding challenge that can impact your child's ability to progress to new or different foods. There's oral motor delays, so the way we're chewing and swallowing, the way we move our mouth, that can impact feeding a ton. We've got anxiety or other psychological components can impact feeding, and so many more. There are some big ones that I frequently see in feeding therapy. Some feeding red flags that I often see or get when I'm doing an intake include gagging during meals. Parents will sometimes report choking, limited food repertoire or variety, so they accepting new or they're losing a lot of foods on tantrum behaviors or avoidance of meal times. These are things that kind of clue me into something's going on with feeding that we need to address. I also forgot to mention this. If you guys have any questions, leave them until the end or write them in the chat so you can remember them, and we'll go over them at the end just so we can get through as much as possible. Okay, so I wanted to put a note on gagging versus choking because this is something that comes up a lot. I love this little rhyme because it helps between gagging and choking. So for gagging, we would say loud and red, let them go ahead. Silent and blue, they need loud and red would be gagging, and the silent and blue would be choking. Right, because when we hear a child gag, it can sound really scary, but oftentimes it's not an alarm bell going off. It's they're doing what they're supposed to. They're getting that food out of their mouth or out of their airway. If they're silent, then we know that something is definitely lodged in there. We need to help them administer first aid, whatever it may be. This is just another little diagram that I like to use. So gagging, so eyes might be watering, face turns red. They might be making a lot of like loud retching sounds or gagging noises. They might vomit. And for gagging, we don't want to intervene. We don't want to stick our fingers in their mouth to try and move something that can actually push it into their throat. And then for choking, they might be staring with their mouth open. You might notice blue coloring in their face, in their lips. They're silent or they're making some like odd sounds, attempting to gasp for breath, or they may be waving their arms or grabbing their throat. There's lots of different ways that people will alert you that they're choking, but those are some big ones that we see. And in this case, you would definitely want to perform first aid. And a big reason why I go over this is because I get a lot of intakes where parents come in and say, well, my child is choking on every food. And that makes me think, oh man, what if something's going on with their airway? We need to look at their throat, we need to look at their swallow. When in reality, a lot of the times the kids are actually gagging. So it can be easily confused. And I just like to make sure that people know the difference between that. so that you can act appropriately or accordingly. Gagging happens for a lot of different reasons. When we have a newborn baby or, a toddler, their gag reflex is very far to the front of their mouth. So gagging happens frequently. You see it a lot when you introduce new foods to a 8-month-old baby, right? They put the food in and they kind of do the and they gag. That's their body's supposed to be there. They are supposed to gag. When we see it in older kids, their gag reflex should be their back by then, but often we see gagging with older kids who have like different sensory needs because they're sensitive to maybe the flavor or the taste or the texture, and it's almost like a bodily response that they're giving to say, I don't want this food in my mouth. This does not feel good or taste good. I'm going to reject it out. So that's when we see some gagging. Okay, so the feeding team is huge. There are more people on the team than just these, but I listed these ones. So we've got family, of course. The family is the expert on the child. The rest of us are here to support the child and the family, but the family is the expert. So number one is we've got OT, speech, nutritionist, psychologist, pediatrician, ENT. There are tons of people that can be on the feeding team. And it's so important to make sure that you have a team that collaborates with each other as well. That's why it's really nice when we have kids who are having feeding concerns, kind of a lot of eyes on them and a lot of different professionals looking at them from their perspective, which helps to give that kind of well-rounded care. If your child, not every kid needs every single one of these feeding team members, but these are some of them that you might see. I put the expert on the child, but also because feeding requires so much work at home. Opportunity for a feeding therapy session. Now, it usually takes, when your child starts feeding therapy, it usually takes they're a little, kind of get to know the child, get to know their, like, what kind of program they want to have them on, figure out what they want them to be doing at home. And once they do and they give that information to the family, the hope is that implementing some of these strategies at because coming to feeding therapy just once a week is not going to make enough of a difference. It's kind of like if you were to go to the gym one time a week and not do anything outside of that, you're probably not going to see the results you want to see, whether it's, building muscle, building strength, whatever. So we always say it's important to come to that weekly session or bi-weekly, whatever your therapist has recommended. And then also make sure that the family is doing the homework at home to continue on some of that care. Okay, so this is really what we're going to be talking about today. And sensory processing is a very broad and complex topic, but it affects all of us every single day, whether we realize it or not. And I just wanted to give some information, and then we'll jump into how it affects feeding specifically. So, sensory processing is the way the brain receives, organizes, and then responds to sensory input in order to behave in a meaningful and consistent manner. So, some examples. So, one example of sensory input received could be that you smell smoke. Okay, so the sensation is smelling. That's the sense we're using. We smell the smoke, and without thinking, we immediately think fire, danger, right? But really, there is a pattern happening within our brain. So we smell the smoke, we recognize it, we categorize it in our brain as danger, right? I associate smoke with danger. That's how I organize it in my brain. And then my response is to get out of the area. Another example, I'm walking in the mall and I feel someone bump into me. Okay, my brain registers, okay, there's a person there. When when I feel someone bump into me, I know that sensation. I register that there's a person there, and I move my body away. So there are different ways that we process these things and different ways that we categorize these things. And for kids with different sensory needs, it's much more difficult for them to categorize certain sensations, certain feelings. And so they might not have the same exact response that we would. So the 8 senses, most people know the first 5, and then the last 3 are ones that a lot of people don't know about. So the most common ones are touch, smell, sight, hearing, and taste. And then we've got proprioception. So proprioception is the body's position within space. This tells me a lot about where my body is in relation to other people or furniture so that I don't walk into something. Vestibular, so this is where your head is in space. So if I turn my head to the left or to the right, I know exactly which way my head is facing, which way my head is positioned, because I can sense it. This has everything to do with your inner ear. That's kind of part of the way that you sense these things. If you're a person who gets really car sick or a person who hates roller coasters, I kind of hate roller coasters now, you might have a more sensitive vestibular system. We also see like kids who have a hard time with laying backwards for diaper changes, or kids who hate the swing and the slide. Sometimes that indicates that there might be something going there to that. With adults, more sensitive to vestibular inputs as we get older. So that's why you learn a lot of people really liked roller coasters when they were younger, and now they hate them because they make them feel sick. So our system, our sensory system is constantly changing, whether it's any of the 8 senses. It's constantly changing, constantly adjusting, and that happens to our kids all the time as well. And then the very last sensation, interoception. So this is what's happening inside your body. This is your stomach grumbling, or you get that kind of like empty feeling. It's hard to describe, but you know what it is. That indicates you're hungry. Or you feel some pressure in your bladder or bowel area, and you know you need to use the bathroom. These are things that we can teach our kids, and a lot of kids have a really hard time. They haven't learned these things. So for some people, sensory processing is just kind of innate, and for others, we have to be able to teach them, and that's why they come in for OT, or vestibular PT does a lot, and they come in and we help them learn to process these different sensations a little bit better. I'll give one more example. Nails on a chalkboard. That for me, it really does not bother me. Yet I know a ton of people, they hear that sound, they process it. Okay, I'm really sensitive to this sound. It doesn't sound good. And they might cover their ears, or they might make a noise or leave the room if they heard that. So, okay, sensory processing and feeding. So this is where we're going to get into how the sensory system can impact our experience with feeding. So sensory processing and feeding, it could be difficulty with the texture of food items. So whether it feels too bumpy or too scratchy or whatever it may be. Oops, sorry. Difficulty with certain smells or tastes. Difficulty with the way things look, if it looks a little bit different and that throws us off. Difficulty with the sounds they make. And this is so complex. There's so many different things that could be different or sensitive about a food, but these are just some solid examples. So I brought back this chart so we can kind of review it again, but with the feeding components. So in the first example, we receive the smell of broccoli, right? Someone puts a plate of broccoli in front of us, we smell it. We organize and categorize our brain as something for maybe a child or a parent or that is sensitive to this specific smell, right? They categorize it as foul or bad or I hate it, whatever it is. And their response is to throw the food, cry, tantrum, whatever you might see with this food, push it away, that kind of thing. Another example, I taste a blueberry. My brain categorizes it as super, super sour. Maybe I'm really sensitive to sourness in my mouth. And so when my brain organizes that, it puts it in the, oh no, no way category. And then my response would be, again, throw food, cry, tantrum, avoid mealtime. Now, as adults or as individuals who have learned how to process sensory information and have a better or more efficient response to it, what might happen now is I would get a plate of mushrooms. I personally cannot stand mushrooms because of the texture. Maybe I would put one in my mouth and I would notice the taste. I would categorize it as, oh, I do not like this texture. It doesn't taste good to me. And instead of throwing it or crying, throwing a tantrum, I would simply remove my mouth or put it in a napkin discreetly and throw it away. So we teach kids in feeding therapy how to process sensory information a little bit better, but we're not necessarily going to change the way that they process everything, right? That would be impossible. And we different sensory needs and different sensory kind of nuances, different things that we respond to differently than the person sitting next to us. So our goal is not to necessarily change their processing. It's to help them process and be able to have a response that is maybe a little bit more efficient. The other thing we work on is kind of decreasing some of that sensitivity overall. So like if they're seeing a food on their plate and it's making them throw the food or push it away, we work on just tolerating it being on the table in front of us, so just calm their nervous system a little bit. There's two sides to what we do in sensory feeding work. Okay, so these are just some things that I hear from a lot of kids when they come into feeding therapy and I put something on the table, whether I'm got it on their plate or so I hear it smells bad. I don't like how it looks. I hate new foods. It's too sticky. It's not sticky enough. It's too cold. It's too chewy. And then lots of nonverbal observations as well. So gagging, throwing, crying, leaving the table. I get a lot of stalling or trying to redirect my attention elsewhere. Sometimes it works. So I work with a lot of these kids on just like helping their body feel calmer at the table. I always tell them like they never have to eat anything that I present them with. That is not my goal. I just want them to feel a little bit more comfortable around these new foods. And oftentimes that will lead to them eventually picking up a new food, whether it's something I present or something they see another kid have. And now that they feel a little more comfortable around foods, they might pick it up and take a taste of it or smell it or just interact with it without having that really system response, right? Their brain has categorized certain things as bad or negative or scary. And I want to try and take that down. So even if they still like the texture, maybe they're comfortable around foods now so that they can experience other foods or be around it and not leave the table now and eating the food that they do like that's still there. I love, love, love this visual. This is from Feeding Littles. This is wonderful. So why does my child struggle with fruits and veggies? So you can see at the top, blueberries are always different, right? You never get two blueberries that are exactly the same. Squishy, sweet, sour. You kind of don't know what you're going to get. Time, which is why we see a lot of kids that really enjoy those like packaged foods, but like don't want to touch maybe blueberry. I really like McDonald's has apple pepper. They like to eat apples, perfect. But because they know it's always the exact same, McDonald's them with the lemon or whatever to keep them fresh looking. It's always going to taste pretty much the same. It comes in a bag. It feels really consistent and really safe. So when we're having constant sensory responses to different foods, different textures, whatever, our brain is going to do whatever it can to keep us safe, which means rejecting anything that feels new, that feels scary, that feels like it might variation to it, and instead pulling in all of the things that feel really, really consistent, that we already know, that we already love, and that aren't going to challenge that sensory system because it does not feel good. Okay, this is a big thing. I hear this a lot from like my parents. I know used to do this for me, but I don't have any I mean, I do, but not like major sensory concerns. So for kids who truly have sensory processing disorder difficulties around food, these tips will not work. So I hear a lot, well, I'll leave the green beans on the table and they'll eat it when they're hungry. Or or if you're talking to a friend, they might say, tell them they can't have their dessert until they finish all the green beans or whatever it is. So sensory processing disorder is not like a choice, or it's not a behavior where the kid just doesn't want to eat it, so they're going to put up a fight. It genuinely does not feel good, in the same way that like a lot of people would hate sitting in a room and hearing nails on a chalkboard. It can be that, but times 10 for some of our kids with these foods. So that's why, like, if you say they'll eat it when they're hungry, they honestly probably won't. I have never, ever heard of that working with a kid with sensory concerns. Worked for some parents, maybe with us, who, those of us who didn't have really huge sensory feeding needs. My parents would put my vegetables on the table and say, you know, you can have your ice cream once you finish your vegetables. Well, I'm able to tolerate vegetables. I just didn't really want them. I wanted the ice cream instead, or whatever it was, the dessert instead. So it worked for me because, you know, all they had to do was change that behavior. But for kids with sensory needs, it's not effective. And it honestly makes it feel a lot more scary, and it puts more pressure on them. So I just explained this, but here's a nice slide on it. So their brain is alerting them that something about the food is or bad or overstimulated. They've received this input, they've interpreted it as too spicy or too soft or too sweet or too sour, or they don't like the sound. And their response is to avoid it. So no matter how hungry they are, they're incredibly unlikely to eat that green bean or whatever it is, or, you know, cookie, whatever. So what do we do? So we're going to go into a little bit about how we treat sensory processing needs. And there are a lot of things that we do for this. So feeding therapy is obviously a huge one. We recommend this all the time, and then we help you through. Environmental changes. These are things that can be done at home just to kind of like help calm the nervous system that is reacting so heavily to these different sensations and feelings and sounds and textures and all of that. We try to keep them on a mealtime schedule and routine, food chaining, small but noticeable changes, food play, modeling, and exposure. And I'm going to go through each of these. Okay, so feeding therapy, I just wanted to talk a little bit about what it might consist of. We already chatted about home programming. That is a huge one, right? We want to make sure that everyone on the team is on board with the home program. A lot of families come in and they already kind of have an idea of, they've been in feeding therapy before maybe, and they already have an idea of some of the things that they should be doing at home and they're incorporating. Or I get families that have never had feeding therapy before. And so we kind of start them on some mealtime basics, things that we want to make sure they're doing at home to support the kids. In feeding therapy, we do exposure to new foods. So like I was talking about, we'll kind of put a new food on the table, or we'll play with it or something like that. And the goal is not for me to get them to eat that food. It's just to help them calm their nervous system and almost rewire their brain so that the brain is not setting off that alarm bell when they see it. They might not end up liking or wanting to taste the food, might still think it's too mushy, but at least we're not having that huge response that's then translating to other foods that they actually might enjoy. We use sensory and oral motor approaches. So in addition to the sensory work we do, we often, or we always, look for oral motor or inconsistencies as well. So oral motor, we're looking at the way the kids are chewing, looking at their strength through their jaw and their cheeks, at their tongue movements, lots of different things. Sometimes a lot of times, if there are sensory needs, there are also some oral motor needs. Sometimes that happens because I'll give a very basic example. If a kid is really sensitive when they're a baby and they only want purees and they won't eat anything else, then if you think about it, all they've learned so far is how to manage just the puree texture, right? So they put it in their mouth with a spoon and they kind of mash it around and then swallow it. If I gave them a piece of an orange or a cookie or something that they had to chew, they likely would not know what to do with it because they've never had to use that skill before. And that's an extreme example, but I do see it a lot. So just a perfect example of a way that sensory and oral motor can combine. Another one is sometimes it's the oral motor that comes first. So maybe a child is born and they have like just lower strength. I'm personally am lower tone, lower strength throughout my jaw. So maybe they're lower strength in their jaw, and then they're only eating foods that are kind of like chewy, softer, right? So they don't have to eat those really chewy, resistive foods. And maybe it looks like they have sensory concerns because they don't want anything that is chewy, right? They're resisting all kinds of meats, basically all of their proteins. So it looks like sensory, but it's really more oral motor. This is something that a feeding therapist can and will help to tease apart. Another thing we work on is utensil use. So we work on spoons, forks, cutting, all of that good stuff. Food chaining, which we will go into in a little bit. Cup and of their diet. I always tell families when they start feeding therapy that feeding therapy is a long game. It takes a while. Okay, let's talk environmental changes. So these, easier said than done, I know. I'm not putting these on here and expecting families to immediately make these changes. A lot of kids are reliant on TV during meal times because it does help to calm their nervous system, right? So, for me, for example, if I'm feeling really anxious about something, one thing that calms my nervous system is putting on some like instrumental calming music. It helps me just really calm myself down. And some of our kids use TV in the same way. So they feel that mealtime is scary because who knows what sensation they're going to get today, right? Are they going to smell something bad or feel something horrible? We don't know. So maybe they're using TV as a way to kind of tap out. The problem with that is that when they are using TV during meal times and only focusing on the TV, they're kind of more passively eating, right? When we watch TV, we kind of passively eat. I could sit in front of my TV and watch The Bachelor and have an entire bowl of pasta without realizing that I even finished my pasta. I'm full now, but like I didn't even remember eating it because I was so zoned in on my TV. We do want kids to more actively eat so that they can experience the food. They can experience those different sensations and different things that they're seeing with their food, even if it's something preferred. So it's a really tricky one to get rid of, and feeding therapists can help you with reducing it. It sometimes just takes a long time to do. One of the things that I'll do is I'll turn the sound really low, but leave the TV on. And then slowly we get to no sound, and then we work down the brightness of the TV. So we're just kind of slowly doing it. Posture is really important. Posture is really important for sensory and for the oral motor skills. So we want to make sure I put this picture on here, and this is a little kid, but older kids should also have their feet supported. So if you're having your kids sit at adult dining room table, that's totally fine, but try and put something under their feet so that their feet are supported as well. So the more stability we have through our feet and through kind of our core muscles and our pelvis, the better our mouth is going to work. It also helps from a sensory component because if your feet and your hips are all supported, you're getting lots of nice input when you're sitting that can help with the regulation and calm a little bit. So that's an easy thing that can be done at home. Just grab a shoebox or whatever it may be. I'm just going to peek in the chat and make sure there's nothing urgent in here. Okay. Yes, Natalie is recording it. So if you need the slides afterwards, she'll get that for you. Okay. Family style meals. I love this tip. This is one of my favorites. This is a great way to bring the whole family to the table if possible. I know it's everyone has busy times. I get that. So this is a great way to do that though, so that everyone can experience the meal together. Now, what I have the kids do is I have them help with serving. So I always say put a couple foods that feel safe for the child on the table, right? So if little Joey likes grilled cheese and peaches, you can have some peaches out, you can have some grilled cheese out, they're on different plates, and then maybe the rest of the family is also having some rice and chicken. So those are in dishes as well. I would have Joey help by serving the rest of the family. So you stop at mom's spot and you say, Mom, what would you like? Or, someone can help them. What would mom today? Okay, mom wants grilled cheese and scoop grilled cheese on and scoop some rice on. Now, if the child does not want to touch the food, that's totally fine. They can use a spoon, whatever it is. But this allows them to have some experience that's positive with the food. They're controlling what goes on their plate as well, but they're getting all this interaction with other foods. Everything's being modeled to them. They're really getting a lot of different feeding needs met in this simple way. And then on their plate, they get to be in control of choosing what they want on their plate. So if they say they only want grilled cheese, great. It goes on their plate and you can remind them, oh, look, we have some other stuff here if you want it. If not, no big deal. We want to keep it super sure. Sensory supports. So there are lots of different sensory supports that your feeding therapist can talk to you about. I like to use like wiggle cushions sometimes. They're those like inflatable little flat disc cushions. And I put them under kids' feet or I have them sit on it. We can have a fidget at the table if it's not too distracting. Maybe if mealtime feels really loud, we can incorporate some headphones over their ears. Anything that can calm that nervous system down. When our nervous system is up here, we're not eating, our body actually shuts all of that down. And then calming music. I love calming music. I do instrumental because sometimes the words, it gets too exciting, especially if it's like Disney, something like we want to try and calm the nervous system, not get them all ramped up and excited. So I try to put some like really calm, just instrumental music on for the table, keep it really soft, and it's just nice background noise. Okay. Mealtime schedule and routine. This is a huge one. This is really hard. A lot of our kids are chronic grazers. I was too. A lot of people are too. A lot of us don't have scheduled meal times unless you're at work. I guess at work, I don't graze as much because I don't have time, but a lot of people do graze during the day. So we really typically want kids eating 3 meals and 2 snacks a day. And then, of course, if they're still hungry, eating a little bit more. But we're trying to break up the day into these meal and snack times because we want to build the hunger and satiety cues. So we're trying to teach kids what it feels like to feel hungry and what it feels like to feel full. If they are grazing throughout the day and just kind of snacking, they're not really getting those cues. They're not really learning those cues, and we want them to. This helps when the table for dinner or for a snack and they feel that hunger. That's going to kind of help them guide them to be more comfortable around foods because they're so hungry for them. It's not going to make them eat a new food, but at least we'll come and sit at the table and feel that hunger cue. Routine is huge. I like to do routines in addition to that family style serving. So if you're able to, I like to set up a little pre-meal where we go and wash our hands first, then we come to table, and then we help serve the meal. Maybe they need a sensory activity before the meal as well. And this is something the feeding therapist or OT can help with setting up. Sometimes we need sensory input just to calm that nervous system before we do something that feels really challenging, like eating. And also, we talked about this, at least one safe food, and then small amounts of new or less preferred food. So I usually do like 2 private snack time. So put a small amount of a new or less preferred food on the table, or if they could tolerate it, on it. Maybe you can sit next to them if they can't tolerate it yet. Introduce a new food to someone, I usually do the size a lot safer and less scary than a bowl of broccoli or pasta. So do one noodle, one blueberry cut in half, or something like that, just to make it feel a lot less scary. If they want more, they can totally have that. Takes the food chain. All changes to it until they get to another food that is completely different. So you're going to be working on trying foods that are similar in taste, color, size, texture to a food that they already eat. And a feeding therapist, this is everything we work on. It's usually this example. This is like a beautiful perfect. But there's tons of different ways we can talk about food, and the most important thing is that you're modeling it and always picking things up. So the way you talk about food matters a lot. And then exposure is huge. So you could take them to the grocery store, have them help you put items in the cart, have them help you pour or bake in the kitchen, or if they're just sitting nearby you, maybe you give them a little bit of the dough that you're using and they can play with it. Going out into the garden or the farmer's market during the summer, just so they can see these different things. And this is a huge one. Feeding is a marathon. It takes a very long time. It's really, really hard for the family, I know, and it's often filled with tons of pressure because parents want their kids to eat. Of course, and I can understand that. It just takes a long time, and we kind of have to move at the child's pace and then kind of push them along where they can. So I always tell families, please celebrate every single win that you get because everything can be a win and is a win. So if your child tolerates sitting at the table when they haven't months, great, celebrate it. If they tolerate a new food being on the table in front of someone else and not even on their plate, celebrate it. New bowl, new cup, any of those like smaller changes, celebrate them. If they, sometimes what I'll see is after a while in feeding therapy, kids will get more curious about foods. So I saw one of my kids the other day, he picked up an orange and smelled it real quick and then put it back down. That's a huge win. These things all tell us that their nervous system is calming down. They're more easily processing these different sensations, and those alarm bells aren't maybe going off as intensely. And they're all huge wins. Okay, I want to open it up for questions. We have a little bit of time left where I can answer those. So let me get out of here. And does anyone have any questions?
I have a question.
Yes.
So I'm just curious, as we're continuing to to our house to kind of grow, like in like or just to basically get something in their system to kind of make sure that they're getting enough nourishment.
Absolutely. That feels very stressful while you're trying to work on these things. Some I don't know if you already are, but do you have a feeding therapist already?
Yes.
Okay, perfect.
Yeah.
Okay,
With you
great.
all.
I would talk to them about maybe you guys adding a nutritionist into the mix if you don't have one already. I use nutritionists a lot because they can work with the feeding therapist, the family, and then the pickier eater to help think of ways to incorporate needed, necessary vitamins, proteins, anything into their diet. This is a really good way to make sure that you have that well-rounded diet, even if they're still really picky. So sometimes that looks like some of my kids only eat peanut butter. So maybe we mix something else into the peanut butter that doesn't feel like a surprise to the kid. They can't even notice it, but it's giving them those extra vitamins. There are some like good resources online if you search like how to get more protein into my child's diet when they're picky. A lot of people have written like blog posts and stuff like that. But I would definitely suggest asking your feeding therapist about getting in touch with a nutritionist as well.
Okay. Yeah. Emily has mentioned nutritionist at some point. So yeah. Okay. Definitely a follow
Perfect.
up with her
Yeah.
on that.
Yeah, and she probably has, we have some referral options. And the only reason I recommend them is because we don't have the training in like which vitamins, how many vitamins we
Mm-hmm.
need to get today or how much protein we
Yeah.
need. We know they need it, but we don't know how much. So, and there are some nutritionists that are so wonderful and they're already trained in working with picky eaters and can really work and personalize something with the family and the therapist. So it's a great team member to have.
Okay. Thank you.
Yeah, of course. Any other questions? Okay. Well, I hope this was helpful. I know it's a ton of information, but Feeding is so complex. It was hard to even break it into 4 different segments. But all of the therapists here that are on our feeding team, we absolutely love what we do. We love helping families, and we're all here for you. So if any of this felt unclear, or like you want more information or anything like that, you can reach out, can connect us, or, reach your feeding therapist if you already have one. I'm always happy to help and offer information and tip strategies and advice. So.
Thank you, Shannon. Next week, we have putting it all in practice. So we'll have some practice strategies combining what Shannon presented today and what Emily presented last week as our third part of our series. And then our fourth part is going to be feeding tools and resources presented by the feeding team as well. Unfortunately, I think our first part of our recording may have dropped off because my internet dropped here at the academy. So hopefully I was able to save that and get a second recording for just now. I'll be sending all the slides and all the information to you guys later this week once I double check everything is good to go for the recording. But if you have any questions, feel free to reach out to us and we'd be happy to answer them. Or if you have a feeding team member, reach out directly to them because they could be more specific with your child's needs. Or if you have something general to send to our feeding team, it's feeding@cptwc.com. That will get directly to our feeding team. So you can ask all of those lovely individuals to pick their brains about everything surrounding feeding. Thank you guys so much for joining us today. I hope that you have a wonderful Valentine's, and we will see you next week.
Thank you. Happy Valentine's Day, everyone.